So I've been working for the charity for about 7 years now. I do skincare treatments. Um, I love what we do. I love the charity. I love volunteering. I take patients out of my office in Norwell. It's called Jordan Warren Aesthetics. And I can't say enough how much I love what we do. I love helping our patients. I've made great connections with my patients. A lot of them I consider my friends now. We text, we check in. And I really enjoy doing it, and I'm happy to be here and to be a part of the team. So the main side effect that I see is severe dryness. A lot of patients through chemo and through radiation, even their medications will cause severe dryness, itchiness, rashes. So the treatments that we do, we really focus on getting their skin hydrated. We do soothing treatments. We do the radiation prep program. So we get a set of products for the clients, and we can actually prep their skin prior to them starting radiation. So that allows them to have less of that side effect of the radiation dermatitis. And most of our clients have gone through that with no radiation dermatitis, no burns, maybe a little bit of pinkness. But aside from that, we've seen great results with that. And then just coming in for the treatments themselves, we make it very, very relaxing. So it can almost be an escape for them to not have to think about the treatments while they're on our table or on our aesthetic bed. They can talk to us if they want to, they can vent, or I tell them I can be quiet the whole time and you can just relax and enjoy your treatment. But that's really the gist of what my treatments are. Anyways, I know Tina and Angela also do the massage. But for the skincare treatments, that's really what I focus on. Yeah, so like I said, my business is Jordan Warren Aesthetics. It is a skincare studio in Norwell. And if you would like to come in outside of the FAB program, if you're not a patient through FAB, you can come in, just mention FAB, and I will donate 20% of your service.
With some cancer treatments, whether it be radiation or surgeries, sometimes there's damage to the lymph nodes. And what can happen is a swelling. So lymph builds up in, it could be an arm, it could be a leg, depending on where the lymph nodes were removed. And what happens is that part of the lymphatic system doesn't drain or work right anymore, and there could be swelling in that area. And so what manual lymphatic drainage does is helps to move that lymph or that fluid buildup from a place that maybe doesn't work as well to other places in the body that haven't been affected by chemotherapy, radiation, surgeries, and it helps to relieve some of that swelling. Swelling can lead to infections. That limb can feel heavy, it causes pain. And so to be able to relieve some of that is something that manual lymphatic drainage helps with. I love the social aspect of it. I love that my clients can come in. We see them, every 4 to 6 weeks, sometimes for years on end. And for them to be able to build a trusting rapport with us and know that they can come in, they can talk about, being newly diagnosed or in the middle of treatment or 10 years post-treatment, and what does that look like for me, and how do I feel about it, and then be able to get a treatment that from a knowledgeable practitioner that has their best interest at heart, with some soothing music, they're at a table for my clients to get up off the table and to say to me, you know what, I feel better. Whatever's coming for me next, I feel like I can take it on because I've spent this hour with you. And when they're leaving, I always say, call me if you need me. And they know that there's a team of people from Holly to us practitioners to our board of directors that will do anything in their capacity to ensure that they're well taken care of. And I think that that social safety net is really important to people who are going through cancer treatment. Yes, so I love doing hospice work. It's just this beautiful, amazing experience, and people who are at the end of life that can have a treatment that is relaxing and that is sort of all about them. They sort of come out at the end of it feeling a little bit better. And I've had clients who maybe haven't been very social or interactive, sort of at the end of it, they smile and they look at me like, okay, you've made me a little bit more comfortable. Thank you. And hospice work is just, I love it. It's amazing. Yeah, so actually just opened up in January. I own Mindful Movements Massage. And for every full price menu service, I donate 10% to the charity.
So I've been with the charity the shortest amount of time, but it has been very rewarding. It started out, I used to joke that I was going to get on board to harass Tina because I worked with Tina at another position. So my joke was I'm going to join the charity just so I can harass her. Little did I know it would really happen. And it's been one of the best things I've ever done. It's called Massage and Skincare by Angela, and I am located in Salon Elegance in Somerset, Massachusetts. Like Christina, I donate 10% of my full price services to FAB every month. It's just been an incredible journey. Working with the different clients that we have, they're amazing. We do so many different retreats and go out and meet people, which has been one of my favorite things. I like to go out to the different not fundraisers, excuse me, the different events that we do out in the communities, meet people, talk to them, tell them about FAB and everything. I have a lot of people that ask me how do I deal with a client when after they pass away, and you have to stop and look at the time that they were with you and the fact that 1 hour that you spend with them, they cannot think about having cancer and their treatments and what they're going through. This particular client, when she started coming to me, she actually had no idea what she signed up for. And then she ended up coming in for her first treatment, and she was like, I don't know why I waited so long to do this. And then she was probably about halfway through the program when she did pass away. But her last treatment with me, she said, you know what? When I'm all done with this program, I'm still coming back to see you. I don't care what my husband says, which just made me laugh and smile. And the fact that just that time she was with me, or any of my clients are with me, where they can just not think about it. A lot of times, many of them have to put on that happy face for their own families, and they don't want to be that way. They want a chance to just, feel sorry for themselves. Not that they're feeling sorry for themselves, but just that time to be like, you know what, I'm scared and I don't know what I'm going to do, but I can't tell this to my loved ones because they're already scared enough.
Mm.
I think everybody right now, just where excessively washing our hands. Our hands are so dry. I don't know about you guys, but my hands are literally cracking right now. They're so dry. Think of that on your entire body, from head to toe, for people going through chemo, radiation, medications that they're on. Think about how painful that is to every day have to deal with that and not really have much relief. It's recommended they use Aquaphor that will keep them moist for a little while, but it's not really going to heal their skin over time. And that's where we come in. We have the products with, the ingredients, the clean ingredients that are really going to heal their skin.